There are different medications that are used for the treatment of diabetes. In patients with type 1 diabetes mellitus, since there is no insulin production, you will have to treat them by the injection of insulin. And so here there are different forms of insulin that are provided. Regular insulin, its effects has peak effects at about 2 to 4 hours after the injection. And then there are short-acting insulins like Lispro and Aspart, and these are used for after meals. So since there is a spike of blood sugar after meals, you can give Lispro or Aspart after meals to correct for postprandial hyperglycemia. And then you have long-acting ones like Glargine and Detamir, which are used for basal control of blood sugar. So in addition to type 1 diabetes mellitus, insulin can be used for the treatment of type 2 diabetes mellitus that does not respond very well to medication. So if you cannot control blood sugar with medications, then you can start insulin injection in patients with type 2 diabetes mellitus. In addition, insulin is used for the treatment of gestational diabetes, and I will go over that in a second. And then finally, if a patient is hyperkalemic, you can give insulin plus dextrose IV fluids to help bring the potassium from the extracellular space into the intracellular space, and this way you can control for hyperkalemia. Now, as for gestational diabetes, I would like to go over the screening guidelines during pregnancy. So you may recall that 16 to 18 weeks of gestation is the time that you will have to use to check for the quadruple test, which checks for the alpha-fetoprotein, estriol, human chorionic gonadotropin, as well as the inhibin, to check for the chance of having a child with Down syndrome. Then at 26 to 28 weeks of gestation, you will check for the possibility of gestational diabetes. And if the patient has gestational diabetes, then you will treat that by insulin injection. And then at 36 to 38 weeks gestation, you will obtain a swab of the vagina and the rectum from the mother to check for the group B S streptococcus infection. And if the mother is infected, then you can treat with ampicillin injection to prevent complications like meningitis in the newborn child. In any case, so the reason I just told you about these guidelines is that it's like 16 to 18, 26 to 28, and 36 to 38. So this way you can memorize it. And it's at 26 to 28 weeks gestation that you will give a glucose challenge test. And if the mother is having gestational diabetes, then you will treat them with the insulin injections. In any case, so these were the different type of insulin injections. Next, we will go over the medications that are used for the treatment of type 2 diabetes mellitus. And metformin is the #1 choice of treatment for patients with type 2 diabetes mellitus. So this is a #1 choice unless there are complications, such as the patient have renal failure, or there is a need to give IV contrast dyes, which will damage the kidney. So kidney damage is serious in patients with metformin intake. So these would be the contraindications to the use of metformin. Now, the main mechanism of metformin function is by decreasing gluconeogenesis. It also decreases the uptake of glucose by the GI and increases sensitivity of insulin, but the main mechanism is due to the decreased gluconeogenesis in the liver. And then the main complication of metformin is lactic acidosis, is the main adverse effect of the metformin. So here is a memory aid that you can use to memorize the function of metformin. So met and formine goes for here, met and formine. So decreased gluconeogenesis is the main mechanism of function of metformin, and then the main complication is the formation of the lactic acid in these patients. So gluconeogenesis metabolites forming lactic acid. So metformin can be used as a memory aid for the function of metformin. The next medication are sulfonylureas, and these were the oldest medications that were introduced into the market. And their function is to close the potassium channels, as a consequence of which the beta cells of the pancreas will release insulin. So there are two generations of this medication. First generation, which includes the tolbutamide and then chlorpropamide, and the main complication of these medications are disulfiram-like reactions. So if a patient drink alcohol along with these medications, they would develop flushing, nausea, and vomiting. And then there are second generations like glyburide, glimepiride, as well as glipizide, the main complication of which is hypoglycemia and weight gain. So one other point I would like to mention here is that metformin is one of the only medications that does not cause weight gain, while the rest of the medications that are listed here, most of them are causing weight gain. In any case, the next class of medications are glutamides, and these function exactly the same as sulfonylureas, and they have the same adverse reaction, which is hypoglycemia. But the main difference is that this is a different class, and thus, in case a patient has allergy to sulfonylureas, then you can switch and use the glutamides for their treatments. The next class of medications are glitazones, and these include the pioglitazone as well as rosiglitazone. And the main function of this class of medication is to increase insulin sensitivity by acting on the peroxisome proliferator activated receptor gamma, which will regulate the transcription and increase fatty acid storage and glucose metabolism. The main side effect of these medications is cardiovascular problems, liver toxicity, as well as weight gain. So here I have provided you with a memory aid, so you can see that glitazones, here we have a G, so the patient is already fat, so weight gain is among one of the side effects of glitazones. And then you can see there's a heart and liver there, so it will cause heart as well as cardiovascular toxicity. And then glitazones sensitizes to insulin. So insulin sensitization is the mechanism of function of glitazones, and it acts by working on the PPAR gamma receptor. The next classes of medications are the alpha-glucosidase inhibitors. So the alpha-glucosidase enzymes, their function is to break down starch and other complex carbohydrates into monosaccharides so that they can be absorbed. So when you will use these alpha-glucosidase inhibitors like acarbose or miglitol, they will interfere with the absorption of these sugars, and thus this medication is primarily good for preventing postprandial hyperglycemia. And because of the same reason that carbohydrates cannot get absorbed, there would be diarrhea, and then breakdown of carbohydrates by the bacteria will cause flatulence in these patients. The next class of medications are amylin, and amylin is a protein that is co-secreted along with insulin. So insulin is produced by beta cells, so when insulin is produced, amylin is also produced. And it has been shown that the function of amylin is to prevent, again, postprandial hyperglycemia. So again, the same class of medication, amylin is used to prevent postprandial hyperglycemia. And one example of this medication is pramlintide. So one important point about amylin is that it can be used for both type 1 and type 2 diabetes mellitus. The next classes of medications are GLP-like peptides as well as DPP-4 inhibitors. But before I go over that, I would like to just go over the physiology. So I have a question for you. If you have a patient and you give that patient glucose tablets, and then you have a second patient and you provide IV glucose to that patient, which of these patients will have a stronger insulin production? Here, the first patient or the second patient? And the answer is the first patient. So through the evolutionary development, the gut or the GI tract have developed its own techniques to regulate the blood sugar, and this is via the production of glucagon-like peptide 1 by the GI tract. And this GLP-1, how it works is that it increases the secretion of insulin, decreases secretion of glucagon, delays gastric emptying, and it also causes decreased food intake. So this next classes of medications are analogs of GLP-1 protein, and these include the exenatide and liraglutide, and you should also be aware that the side effect of these medications are pancreatitis, as well as nausea and vomiting. The next classes of medications are the dipeptidyl peptidase inhibitors, all of which are ending with the name gliptin. So DPP is the enzyme that will break down the glucagon-like peptide. So by using the DPP inhibitors, you will inhibit the breakdown of the GLP-1 protein. And the main side effect of these medications, since they would cause the imbalance of immune function, is that these patients will develop upper respiratory tract infections as well as the urinary tract infections. And that concludes our discussion.